I'm Mercedes Von Deck. I'm also known as Dee Dee, and I'm an orthopedic surgeon at Cambridge Health Alliance, and I'm also a Feldenkrais practitioner and a JKA Solvents and glue teacher. What I notice in most of my patients is that they all have a lot of patterns or habits of movement that really aren't that functional. And as people get older, they do move less, and then they forget how to move. I actually taught a class today, and this woman was doing shoulder things, and she's like, I didn't realize my left shoulder blade could move. And all of a sudden, it was like, wow, my shoulder blade can move. So I see that a lot with people who aren't so aware of their bodies, that they're just not moving, and it starts leading to more problems, and they have, difficulty walking, difficulty with pain in different areas, and it's very hard for them to find a way out from the pain, from the difficulties. Movement is life, movement is what you need to do. And, I see so many people, both orthopedics and in the Feldenkrais world, that have come to me because they have pain in both realms. And it seems like I sometimes feel I can do so much more for people in the Feldenkrais world than sometimes in the orthopedic world, especially for things like back pain, where people don't necessarily need surgery. There's nothing that's clear cut that they need surgery, or, in general. I mean, there's certainly a role for surgery in a lot of things, and I tend to, fractures, it's great because it's very clear, they need a plate put in their arm, and then you feel like, okay, this is what you have to do. But some other things, it's not so clear. And I think that there's a big role in learning how to move better. Part of the reason I did my Feldenkrais training was because I felt that even though I had a lot of knowledge as an orthopedic surgeon about anatomy, surgical approaches, I felt like I really didn't necessarily understand how movement happened. And so I think you really have to look at that. You have to study that. And you can do that through your own body and how your body moves, but you have to give yourself the time to be able to explore. People who have back pain that they've had for a while, or even if it's something acute where it just started, the muscles just start contracting and they can go into spasm, or even if they're not in spasm, they're just working way too hard. Much of Feldenkrais lessons in general, and Solvents and glue and Jeremy Krause's work involves, turning, moving, rotating the spine. The Solvents and glue can be really helpful because there's that movement of the pelvis, which of course moves the spine. So anything that can move the spine, that's very valuable whenever you're having any kind of back problems, because that's often something that you lose very quickly, and then you lose the movement, and then pain just gets worse. And there seems to be no way out.
And what if it's too uncomfortable to move?
So, that's the nice thing about Feldenkrais and Solvents and glue. It can be you can imagine the movement, but which is very effective, actually. Yeah, the movements can be so small, but that's something that is hard for people to learn. I've tried to show people in the orthopedic office, and they do it in a small, little, gentle way in the office because I'm guiding them, and then they come back 3 months later, and they're like trying to move so big, and because that's what they've learned. They've learned that from physical therapy to work harder. It's what we learned growing up. We're always confronted with working harder. And so that's not necessarily the way to get out of pain. And so a lot of times you have to really wind it back and do very small, easy, gentle kind of movement. Sciatica is a very common condition, and there is this irritation of the nerve. But sometimes it's not even, often it can be like a disc pressing on the nerve, or, there's a space where the nerve comes out, and it may not necessarily be the disc, but the ligaments. And so, again, all those muscles that are affected by the nerve get super tight. And so often that perpetuates the pain. And so people can get totally immobilized. We've all seen them where you can't even move. Just finding your way back into movement with a Solvents or glue or Feldenkrais can be a really great way to do it. And so something more that brings more awareness of themselves as well is very helpful. So not just that the movements are gentle, but that they start to understand how they're moving, how they can move when they're in pain, and then how to prevent pain. I find the Jeremy Krause work, the Solvents and glue, can be accessible to people, it does really clarify how something moves. You just does a few movements, does many variations. You can start making up variations. It seems to almost move in a progression a little bit. So, you start with something easy and then you can add on. And of course it's done standing, which is what a lot of people complain about posture, about how they're walking. And so it does improve both of those things. And something about being standing and feeling the force coming up through your feet and up through your body from the floor definitely gives you a more energized feeling. So it makes you understand your structure better. People can feel it pretty quickly. They can feel the difference, and then that helps them be motivated to continue. So when I was at an orthopedic conference, it was a talk about spine, and the spine surgeons were just accepting the fact that as we get older, we're going to be more rounded and the head is going to come forward. And this is the natural human state, to just sort of have this flexion and, head forward, the posture that we all don't want to have. And they just thought that was natural. And their solution is to fuse the spine. And they will even, they try to line the head up over the pelvis, but then it's fused. And so you lose all the movement. And that's just, we know that it causes problems at other levels of your spine because big block of your spine isn't moving. It's not ideal, and it causes problem with all movements. But it's what Western medicine knows a little bit, We know that we can do that. Or they've been struggling, they've been trying a lot of different things, they can't find something that works for them, and so they turn to surgery. So then it's really important because they have lost a lot of movement, and then often the other muscles around that area are just going to hold you. And so I think these practices are so important because you have to find that movement again. And you can find movement, and there's still going to be a lot of movement in all the rest of you, and it will certainly help you function better. I actually know someone who's had 3 spine surgeries. She still has a lot of pain despite these 3 surgeries. The Feldenkrais is kind of unwinding that because you need to have movement. You can't just be still. I'm constantly amazed. I've been doing Feldenkrais. I started doing it in my 20s, and I'm still amazed. I've seen a number of people where they really are kind of immobilized by their pain, whether it's sciatic pain, and sometimes that goes away, but then there's something else, and they get in this state where they feel like they can't move till they get out of the pain, and then they can never get out of the pain. Well, movement is the way to get out of the pain. I feel like, thank you that I'm doing this. Thank myself that I'm taking the time to do it, even if it's just a short amount of time at the end of a stressful day. Start to, it loosens up the chest. I start to breathe, and what would I do without this practice? Any of these practices that I do, but the Solvents and glue and the Feldenkrais is just so special, because I'm in my 60s, so it just is so important, and I'm always thankful.